Good morning and good afternoon to everyone. Welcome to our Family Drug Court Learning Academy webinar series, Leading Change. I want to welcome everyone to this webinar today. We have a lot of participants, which is really exciting, and so we're hoping today to address most of the questions that you all sent in when you registered for this webinar. It was pretty impressive to see how many of you had questions that you would like addressed today. So we're going to do our best to get to those. My name is Teresa Limas, and I'm going to be facilitating part of the webinar today. I work with Children and Family Futures. I've worked with Children and Family Futures since 2007, working with different program areas, but in particular working with family drug courts across the country. I'm going to be joined later in this webinar by two individuals from the state of Colorado, and we're really excited today to approach this topic of who wants to be a coordinator from two different perspectives. One in particular is from the state level. Many of you in your states have state drug court coordinators who have some role with your family drug courts, and so we'll get to hear from Brenna D, who is the state coordinator for the state of Colorado, and then we'll also have a hands-on coordinator from the state of Colorado as well in Jefferson County, Colorado, and she is going to talk to us about the specifics of what her role is as a coordinator. So I'm going to open up with some initial slides, and then we'll be able to hear from both Brenna D and Tessa this morning. Our learning objectives for this webinar are to just look at the common challenges that a family drug court coordinator faces. Also, some of the very unique things that they get to face. A lot of times when you talk to coordinators, they absolutely love their jobs, and they have a lot of challenges. So today we'll sort of hit on both. What it's like to be a coordinator where you have to be a problem solver, you have to be a diplomat, a negotiator, and an ambassador. And so we'll talk about that, as well as some of the things that you all had questions about as you registered for the webinar. I'm going to go back here. We have an opportunity as we go through the webinar this morning for you to ask questions. So if you have a question that pops up that you didn't submit when you registered, off to, I believe it's your right-hand side of your screen, you can type in the chat box a question, and as those questions come in, we'll be watching that chat box to see if it's something that we can incorporate in real time, and if not, we have some time after this webinar today for additional questions. So after the webinar concludes at noon Pacific Standard Time, we will have a conference line that you can call into. The slide's up right now with the number, so you can jot that down or refer back to it. But if you'd like to have individual time with the presenters or some of the other Children and Family Futures staff who work with family drug courts, we'd like you to call in, use this conference ID, and we'll have about a 30-minute session where you can ask very specific questions, or we can get to some very specific content. So we encourage you to use that if that's something that you're interested in. We have a polling question just right off the bat, and we'd like you to take a look at this, respond to it, and then we'll sort of talk to you about the results. So the most significant leadership challenge that we face in our FDC with the coordinator position is, and you've got a few choices there, so we'll give you just a minute to respond to that polling question. So it looks like, probably not a surprise, so I'm laughing a little bit, balancing case level and administrative tasks was, it was one of the primary responses. It looks like it came in second. Managing partnerships or relationships, and that was the one I was chuckling at a little bit. So yeah, as the coordinator, you have quite the balancing act when it comes to managing very different types of people in professions that have different ethical responsibilities. They all come into the family drug court team with a different set of responsibilities. They have a lens that's different from anyone else, and so that can be quite a challenge. Sustaining and funding the position, we'll talk a little bit about that, and you're just spread too thin. And so all of these are very common, and again, we had 167 questions come in, and I'm sure we're going to have more as the webinar progresses. So we won't get to everything today, but we do use every one of those questions that you submit, as well as your feedback after the webinar, to to develop new webinars and to really tailor technical assistance. So if we don't get exactly to your question, we'll give you some opportunities to follow up with us. All right, so if any of you are coordinators, and I know many of you are, this might look like you, the Family Drug Court Coordinator is really, again, they're in a constant balancing act. They are seen as oftentimes the core of the team. They have so many responsibilities. They have a lot of tasks, and many of them don't necessarily align with the skill set that the coordinator, comes into the position having. So, some of the questions that we received were, what type of person makes the best coordinator? And so, that, and we're going to say this over and over again, and you'll hear this when we talk to the Colorado folks, every family treatment court is different. Every family treatment court has different needs. There's the sort of context of who else is able to staff that team, and so we're not going to be able to give really absolute answers, but to give you some guidance as you think through some of these things. Some of the coordinator roles and functions can, and I say can because, again, I think it's very dependent on what other folks you have on your team. It can be contract management. You may be in charge of compiling data and reporting that data back to your team so that you can do ongoing, program changes, that you can look at quality assurance of the services that you're providing. You're preparing and managing oftentimes the docket. Sometimes the coordinator is also providing case management services, although we see more and more that those are sometimes two separate functions depending on the size of your family drug court, how many families you're able to have at any one given time. So capacity and numbers make a big difference in terms of what roles and responsibilities the coordinator has. You may be overseeing the budget. You may have had to grant write to get this position funded, and we saw that just in the polling questions that some of you said, you have to maintain and figure out how you're going to keep your position funded. And so, again, some of these skill sets that you're expected to have don't necessarily align with the skill set that you came to this job with. So some of being a coordinator is figuring out what are my strengths, what are my challenge areas, where do I need to learn so that I can better meet the needs of this family drug court, and where do I need to pull in resources to help me and shore up the areas that I may not be as strong in. So again, when we think about the family drug court coordinator, really what we see a lot of times is they're one person that's expected to be all things to all people. And I have to say that the role of the family drug court coordinator changes depending on, the stage that the family drug court is at. So if you're in your very initial planning for this, you're trying to start a family drug court, if you have a coordinator at that time, that person may be the grant writer. They may be the person writing policy and procedure. They may be writing the drug court handbook. They may be doing a lot of things as startup that they may not be doing later down the line. So, as you get further, that drug court gets more mature and you've been in place for a while, that role changes, and there may be a settling in of the coordinator, the community resource person who really is the person who's the ambassador to other providers, who can pull in stakeholders, who can manage the oversight committee. So what we see with family drug courts is that coordinator position changes depending on the stage of the drug court. But what we do know is that this person is expected to be a liaison. You're a liaison to attorneys, even though you're not an attorney in most cases. You're the liaison to the treatment providers. You're the liaison to your child welfare department, to domestic violence services. You're the liaison and sometimes the right-hand person to the judge. And so as you can see, as some of you well know, it can be a very exciting job, but it's also, again, a huge balancing act, and you have to be really good at negotiating systems, understanding who your partners are, understanding, how do you approach the treatment providers in a way that they're going to come to the table prepared and with what they need, which may be very, very different than how you approach your child welfare folks and get them to come to the table with the things that you need from them. So, you're negotiating a lot, you're really working with various different types of personalities, and so you really are sort of all things to all people. So the realities of the FDC coordinator, I've talked about some of them. I just want to go down this list because we thought this was a really good list. Oftentimes you're under limited direction, so you may not even have a supervisor that you get to connect with on a daily basis. Sometimes that's the judge, and that can be a challenge because they don't have a lot of time. You have a lot of responsibility. You may not have a lot of authority, and that came through in some of the questions that we had. You don't get to choose your team members a lot of times. You know, when the treatment folks send their liaison or when the child welfare folks send their workers, you don't necessarily get to choose who they are. You do hopefully get to coach those individuals on here's what we need from you. You may get to orient them to the team. So you get to set the stage for how that team comes together. Although as I say that, you know, we also know this is a group dynamic. So you as the coordinator has to be really skilled at negotiating and helping just keep the tone of the team dynamic, but you have a lot of different personalities coming into play. So you don't have your choice in team members, but you do have some influence, hopefully, in how your team operates. And then add to that things change all the time. You've got changes in staff that are coming into the family treatment court team. You have a lot of politics, and you have changes in funding which change the way that the program operates. Oftentimes there are resource limitations that you have to deal with, and so we often see that the coordinator is the one out there beating the path, trying to figure out, okay, our families need bus vouchers. How are we going to get bus vouchers? So there's also that issue. Again, coordinator, all things to all people, and there's a lot that goes into this position. So what have we seen being effective? I've worked all over the country with more coordinators than I can count, and I would have to say that it's one of the best groups of people to work with. Again, they love their jobs, and I think that's one thing when you're looking at, you know, who should we have as our coordinator, somebody who's really passionate about their job and their role and understands, you know, the strengths they bring to it and understands where they need to get help. I think one of the things we see as being very effective and encourage on a regular basis is communication. Communication needs to happen often, and it needs to be open, and that includes, as a coordinator, asking the rest of the team, how am I doing? You know, what's working in the way that our drug court is functioning and what's not working, and maybe that can be anonymous, but that's one of the things I think that we see as effective is that even the coordinator is asking, how am I doing, and am I meeting the needs of the rest of my team members, just as we would do with any other team member. We know that the coordinator position has to be really effective at being a problem solver, and they have to be really good at working with our target population, with our families. And so there are some very specific things that we think make a good coordinator, including training, that they understand. They really understand the science of substance use. They understand that it's a brain disorder. They understand that the challenges related to treatment agencies, as well as the dynamics and all of the mandates that child welfare has. Your coordinator absolutely needs to understand the Adoption Safe Families Act and those timelines. And so, again, it's a lot of training, motivational interviewing. So a lot goes into this position, and I think when those things come together, you tend to have a really strong coordinator. Some of the biggest challenges and pitfalls that we see that we'll talk about as we go through our question and answer with the state of Colorado is, you know, there are some challenges that we see with coordinators, not coordinators themselves, but with this position as well. One of those is oftentimes the coordinators sort of, you know, they have to own this. They have to feel really passionate. They have to have some ownership over this family drug court. But there's a fine line between that and that coordinator thinking this is my drug court. So that's a common challenge, and one that the team has to address. Taking things too personally, being too project focused, being too focused on, and this might not sound so good when I say it, but being too focused on the families and not as focused on the dynamics of the team, the community, what the outcomes of the treatment court program are producing, and so there has to be a balance between the project and the bigger system. As I keep saying, the coordinator has to be all things to all people. That's a challenge too, because the coordinator can't be everything to everyone, so there's got to be some boundaries. So again, really understanding what this person brings to the table and what they need to bring in to the context of the team so that they have some supports. And then finally, one of the other challenges is if you have a coordinator who doesn't understand the importance of neutrality. Yes, they may work for the court. They may be a child welfare. Their background may be in child welfare. Their background may be in treatment. That doesn't necessarily matter as much as it matters that this person has an understanding of all three systems and that they are coming to the team and sort of leading the team with a neutrality of understanding all sides and helping sort of draw things together. And so there can't be a one-sidedness with the coordinator. And so that's a really important challenge that we encourage teams to look at with their coordinator. A couple rules of the game. Know your partners. Know their views, their concerns, kind of know how they're going to approach a situation, and again, having an understanding of your partners really helps to facilitate team dynamics. Understand who the decision makers are. Determine the level of collaboration that you need. Be able to manage both at the team level but also at the systems level is going to be really important. Looking at your team as a coordinator, or even listening to your team as a coordinator and understanding that you've got a lot of people coming together. We had questions that came in about how do we team build. One of the best ways to team build is to look at what are some things that we need to learn more about. Medication-assisted treatment, we see that all the time recently, and how do we approach medication-assisted treatment? Well, maybe your team needs to get some training on that, and we know that training opportunities when done as a team are great team builders. So again, that's another role and place that the coordinator can be very effective. Okay, I kind of sped through those because we wanted to spend most of our time today in a panel discussion, and so I'm going to turn it over to ask my two panelists to introduce themselves and tell us a little bit about what their role is in the state of Colorado. So Brenna D.
Thank you, Teresa. My name is Brenna D. Rice, and I'm the State Problem-Solving Court Coordinator. So I work with all 79 of our operational problem-solving courts in the state. And just by way of background, I actually started working in a family drug court about 12 years ago, providing direct service to families that were in the program. And from there, I helped start another family drug court, and then was actually a coordinator for a criminal drug court as well. And then about 5 years ago, I took a position at the state level to work with all of the programs across the state, and I've been in this position, as I said, for about 5 years.
Thanks, Brenna D. Tessa, could you introduce yourself?
Sure, thank you. Hi, everyone. My name is Tessa Richter. I am the Family Drug Court Coordinator for our program here in Jefferson County, Colorado, which is just about 15 minutes west of Denver, if you were wondering. I've been in this position about 1.5 years so far. Before this, I was the lead child welfare caseworker on the same Family Drug Court team in Jeffco. And just to give a little context on the program that I work with, our program is about 6.5 years old. It's called the Family Integrated Treatment Court Program. We call it FIT Court. And so I've been working with the FIT Court program for about 5.5 of the 6.5 years that it's been in operation.
Excellent. So we're going to jump into some questions, and I think a lot of the questions that our participants asked are going to come up in these discussions. So I'm going to start off with asking Brenna D, as a state coordinator for Colorado, what is your role in helping to hire and shape the coordinators across the state from your perspective?
Thanks, Teresa. And if it's okay, I want to provide a little bit of context as to how we got coordinators and kind of the process of even getting state funding for these programs. And really, coordinators are a pretty standard practice in all of our criminal courts. And we've had coordinators in those courts pretty much since the beginning, but received permanent funding in 2009, but it didn't include family drug courts. And so when I came into this position, I really, my background working in a family drug court as well as being a coordinator in a criminal drug court, I really understood the critical component of having a coordinator for these programs. And so I went to the legislature and asked for coordinators specifically for our family drug courts. And outside of that, judicial didn't have any position like this with our family drug courts. And so I really see, my role as advocating for the family drug court position internally as well as externally with our legislature and with other stakeholders. And I think another part of my role is working with hiring managers and supervisors to make sure that they understand what this position is and the key elements that a program coordinator needs to have to do an effective job. And because this position is so unique, often in some jurisdictions, this is the first time that they've ever even had a coordinator position, and so it really can be an awkward fit to know who is going to supervise this position, and oftentimes the supervisor doesn't have a lot of an in-depth understanding of how a family drug court functions and the role of a coordinator. And so by default, sometimes they end up, either being supervised as some other court administrative staff, or as you alluded to earlier, Teresa, that they really don't get much leadership or supervision support because their position is just so unique. And so I see part of my position as really kind of being that liaison and helping managers understand the position and what they do. And also I see myself as creating an environment for coordinators to be successful, and a lot of that is really encouraging a learning community among coordinators themselves. And I know because our family drug court coordinators, they all started around the same time, so it really created this pretty cool place where an environment where they are all really talking to each other, they email each other very frequently, they meet, they offer trainings for each other, and really help each other as this position has developed in the state of Colorado. And so part of what I want to be able to provide, or I think my role is being able to just really encourage and help this position be successful in our courts. And another part is just making sure that training is available, and we also have an annual conference for our family drug courts and quarterly meetings as well, just to stay up to date. And so those are, that's kind of at the statewide level, my role with the coordinator position.
Excellent. I would be, this is Teresa, and I'd be remiss to not say this, because we do work all over the country with providing training and technical assistance with family drug courts. When we talk about coordinators, I think it's important to say that some family drug courts don't have the numbers. They don't have the capacity to sustain a full-time coordinator, and they may not need a full-time coordinator. And so when we say coordinator throughout today or any time, I think it's also important to know that it's somebody who can coordinate. It doesn't have to be the coordinator. I know in some jurisdictions there are liaisons that serve as the coordinator on a part-time basis, coming from the treatment system, coming from the child welfare system. And so if you're sitting out there thinking, well, this is just great, we don't have, a state coordinator, and we don't have, a coordinator for every FDC, that's okay. I think part of what we'd ask you to listen for today are, what are the roles and responsibilities, and that those things can be fulfilled in something other than a designated coordinator, and that's certainly something that we want to keep everyone open to hearing. So, Brenna D, thank you so much. I'm gonna go on to the next question, and I know there's probably many people out there just dying to ask this. So, Tessa, you said that you actually were a team member of your family drug court, and you came from the child welfare system. So what I'd like to know is, do you think coming from child welfare helped or hurt your credibility with partners initially when you came in as the coordinator?
Initially, I think this has really helped. My team knew me. We had existing relationships that were positive, and so the team knew that I knew where our program had been, where it needed to go. I had a good background there. I think child welfare was happy to have someone in the court system who understood their language, their budget, their challenges. You know, I knew what TDMs and FEMs and all these things stood for and what the point of them was. And I think the court was happy to have someone who understood child welfare's language and challenges and the same thing on their side. That all said, though, I have to be careful still to check myself, see where I'm coming from, and make sure I'm not taking that mindset of a child welfare worker. I've had to spend time, and this is ongoing, intentionally learning more about guardian ad litem and RP counsel treatment, where their perspectives come from, what's their mission, their challenges, and not just assume that I've already known things. So I think overall it's been a good thing for me and for our program. I can see where, based on where some relationships are, that could be challenging, but I think for us it's been a positive move.
Excellent, excellent. Okay, so this is kind of a big question. I'm going to start with Brenna D and ask, what are the top 5 or 6 critical elements that you have found to be game changers for the coordinator position? This is the 3-part question. And is there a top one? I'll go with those 2 first, and then we'll go to the next bullet. So top 5 or 6 critical elements, and is there one that you think is like the most important for coordinators?
So I think that overall, kind of how I view the coordinator position is, you really have to have 3 main areas of focus, and I kind of call it the health of the team, the health of clients, and the health of the program. And I really intentionally use the word health because I think the coordinator is responsible for really kind of taking the temperature of each of those responsibilities and determining what are the needs, where are there areas of improvement, and where are we doing well in each area. And then also a lot of, as far as care for the clients, I see that as, kind of more, not necessarily case management, but connecting with community resources to make sure that the needs of the clients are being met. And Teresa, I think you really hit so much of the areas that are important for coordinators already, so I think I'm just kind of adding to it and expanding maybe a little bit. But I think you need a person that has the ability to see the 30,000-foot view, so kind of the larger programmatic piece, as well as the day-to-day management, so down to details like data input and things like that. I also think being visionary, so someone that can look to the future and know where they want to see this program going, as well as, I often joke that middle children make great coordinators because we're used to kind of being those mediators and peacekeepers and facilitators between siblings, and I think that that skill set is really important in effectively managing relationships on a family drug court, and that goes for internally with the team as well as externally with stakeholders. And I would say the number one, kind of the number one critical element for a coordinator is really just the desire to always be learning and improving, because I really think the moment that we stop doing that in our family drug courts is when we are really at risk of, one, having not serving our participants to the best of our ability for good outcomes, and also really at risk of the program not being sustainable.
Excellent. So when you think about a coordinator position, are there any characteristics that you have found to be most ineffective? And you kind of alluded to a little bit, but this is being very direct. I mean, is there, because you've seen many coordinators just in your own state, is there any 1 or 2 things in particular that you think, well, we really need to stay away from that?
I will say that I think we have amazing coordinators in Colorado, and as I was kind of thinking through this question on kind of a larger scale, I think a characteristic that could be challenging in this role is, or that might not be as effective is someone who has narrow views of their duties and position. So that can really limit how they see themselves really being a program director. And so kind of some of those self-imposed or artificial limitations, I think can be very limiting on what the program can be and grow into, as well as what the coordinator position can be and can grow into as well. So I think it's always just a good a good thing for anybody in any position, but particularly the coordinator position, to really be looking at, am I setting artificial limitations on my duties or on our program that don't need to be there, that's really impacting our performance overall. And then also not embracing and developing your informal leadership role, because oftentimes coordinators don't necessarily have a formal leadership role, but I think we really can and garner a lot of power within our position if we can embrace an informal leadership role and be able to utilize that to develop relationships and networks that can really support and sustain our programs.
That's an excellent story. I love it. And I was chuckling too because I wish we would have added a polling question asking all the coordinators on this webinar today if they're a middle child. So any of you out there that are middle children, just smile right now. I'm one of them. So that's great. Those are great analogies. So I'm gonna move on to, and thank you, Brenna D. Move on to ask Tessa a question. Tessa, we would love to hear from your local position. When you came into your role, I'm sure that it was different than it is today. So how do you see the role and the function of the coordinator changing over time from planning to early implementation and long-term operations?
I think your role definitely changes through these positions, and your leadership perspective, I think, changes as well when you're going through these different developmental periods. When you're looking at the planning stage, I think a lot of what you're doing is inspiring that shared mission, really working with the team to set the goals that you want to accomplish, do a lot of brainstorming, just really thinking big picture. Like, we get so set, kind of like what Brenna D was saying, we get so set in what the system is like and what things need to be that we forget that a lot of that may be arbitrary, and maybe we can break that down and change it so we have better outcomes for our families. So I think in the planning stages, it's a lot of that, getting excited, this can be something different. Providing a lot of education for your team about drug courts, about the key components and best practice, what that looks like, encouraging, or I would say requiring anyone who's going to be involved in your team to observe other drug courts, family drug courts, adult drug courts, see what different ones look like and what people like, what people don't like. Doing a lot of organizing and facilitating trainings, and then making sure that you're enabling others to act, not taking over. If you want a program to be successful, you really need full team to be, bought in and contributing to it. It's easy when, especially, and I know everyone's kind of in a different role, but for me, this is my full-time job, and so, I'm not in the crisis moment every time like most of my team members are, and so trying to remember that and ask for everyone to contribute, but also recognizing that they have other things going on as well. In your planning stages, you're going to be doing a lot of the organizational piece, project management skills, doing what you say you're going to do, following through, making your handbook, making your policies and procedures, and a lot of problem solving too in that first stage. Looking at early implementation, I think getting things going, but making sure you're sticking with the family drug court model, keeping your team focused on those agreements that you all made. And then I think a really important piece is facilitating or encouraging an attitude among the team that this isn't going to be perfect off the bat. Nothing's going to be perfect. But not being critical about your program, but being open-minded and encouraging that in others. I think on one side, people get set, like, this is what we decided, this is what's going to be best, and then you don't want to change it when it doesn't work. Or on the other side, it's not working, and so you want to change it right away. But sometimes you don't obviously need to throw the baby out with the bathwater, and sometimes you just need to sit down and meet and work things out a little bit better. And then looking at the long-term operation stages, this is where my team's at a lot right now, and I think what we've been doing a lot of is breaking down barriers and challenging the process, really just trying to be innovative for what we're doing. Again, it's, challenging those arbitrary things that might not be working for the families, but we can make it better. I think the other big piece is keeping your team motivated and encouraging them. It's a hard job. Everybody knows that. We're working with some really difficult situations, really sad situations, and keeping the team set on successes. One thing our team just implemented is at the beginning of each staffing, sharing before at the beginning of staffing, before we start to staff the client, to share a success story or share something that has worked well, just to keep the attitude up a little bit and to keep everyone excited about what we're doing. I think another really important function when you're looking at long-term operation is the sustainability piece, trying to institutionalize what you're doing into the bigger system. And I can talk a little bit more about that later. A lot of developing new partnerships, expanding services, and really just focusing on what true collaboration is with your partners, making sure you got that shared mission and your outcomes, and everyone's really trying to accomplish those goals together.
Excellent. Those are excellent points, and I think you drew in a lot of the things that folks asked in their questions around sustainability. But what I think I heard you say the most is that, you know, a lot of what you're doing is garnering resources and the skill set of others to keep things moving forward, rather than you're doing everything yourself. And so I think your points were well made. I do want to remind folks, we have some questions coming in the chat box, and we're going to try to get to those. If we don't get to those during the 1 hour webinar time, we'll have the post-webinar phone call, but we will try to get to those. But if you have other questions, please put them in the chat box. I'm going to go ahead and move on, and I think this might be, this is actually a really good question, and I want to be really specific. If you have a new coordinator, and they could come from the treatment system, they could come from the court system, they could come from child welfare system, they could come from another system. Regardless of the system they come from, if you have a new coordinator and you get to start working with that person to shape them and get them prepared, how are you going to do that? Is there specific training, or what would your approach be to training an FDC coordinator? And I'm going to start with you, Brenna D.
You know, I think one of the first things I would do is make sure that the coordinator is intentional about getting to know each of their team members and understanding the nuances of each role on the team. And if they don't have, you know, depending on where their strengths lie, really be, you know, if that's, again, in treatment or child welfare, really being intentional and spending time getting to know and understand the other parts of the system as well. And of course, a really good understanding of what the best practices are, what is the most up-to-date research on these programs and how operating them, and even I would say on the implementation science side as well. So if we know from research what works, how do we actually on the ground implement that and know that we're doing it well? And then I think just some like general trainings or skill sets that would be helpful for a new coordinator is group facilitation skills, conflict management, budget management, and then as Tessa said as well, I think already, really what are the leadership characteristics, and how do you see yourself as a leader in this role as well, and how do you perform from a leadership standpoint in this role? I think training around that would be really helpful as well.
They're excellent. I'm going to ask Tessa, anything, because you came into this specifically, is there anything that was particularly helpful or maybe not as helpful for you, or you wish you would have had when you came into the coordinator position?
Well, I can tell you what, some things that were helpful, and part of this was my education or training in child welfare, but trainings that we had for the Family Drug Court team. I think basic understanding of treatment modalities and what substance abuse monitoring looks like. Those are some really important things that you need to be the expert in, not necessarily how to do the treatment, but understanding what they are and who's appropriate for each kind of treatment, how to do kind of those brief therapy modalities, motivational interviewing, solution-focused, strength-based. So when you're interacting with clients, even if it's just for 2 minutes after they talk to the judge, that you can encourage them and help them in the program. I would echo a lot of what Brenna D said for sure. I think the leadership piece has been really important to me. I didn't come into this, I mean, I have a master's of social work. I didn't have a lot of leadership trainings or understand what, leadership development models look like, and that was a big missing piece for me. Just in this last year that I really noticed I was missing, because I am in a leadership role here, and I have a lot of ability to help facilitate change, and I wanted to take advantage of that. And so leadership's a piece that I'm working on myself right now, and it's really interesting and incredibly applicable for this position. And then I think lastly, just a good understanding of community resources, what's available in your community, how to partner with those resources, or at least how to make those referrals. My co-coordinators here and I joke around about how one of our job duties is to find unicorns, because people are always kind of looking to us to find those missing resources, find that perfect fit, that perfect housing, and sometimes we can't because we meet with people and we know those things.
Very good, excellent. I have one last question, and if you maybe just want to add one or two things here that you haven't already, that would be great. So, from your vantage points and experience, what was one or two of the key challenges and critical lessons that you learned along the way as you got to where you are today? Is there a summary you'd like to give us? I'll start with you, Brenna D.
Sure, thanks, Teresa. I mean, most of the challenges or lessons learned are definitely because, well, I didn't do things, or, learning from experience, I didn't do things the way I wish I would have now looking back. And I do think, one of the areas that I just didn't pay enough attention to initially was really being clear and about the role of the coordinator with hiring managers and with really leadership in each of the judicial districts. And so being able to talk to them about what is this role, what are the key responsibilities, how do you support this role as a manager, and so really kind of training them before bringing on this position or during any transition with this position as well. And how can they provide direction and oversight without kind of, or actually acknowledging the coordinator's unique position and what they do for the program. And the other thing I would say that can be a real challenge that needs, that as a coordinator needs to be addressed is being able to really effectively address conflict. And so I have seen how avoiding conflict, it really just builds over time, and then it can explode and become much worse and toxic for the team than if it's addressed in the beginning or early on in the process. And also, don't be afraid of data. So many coordinators don't come into this position as data experts or as staff experts, but that's a really important part of the role. And so really seeking out opportunities to learn more about what are some simple ways that you can collect data, that you can analyze your data. And I think that there are enough, there's enough information, and there's really simple ways to be looking at your data that don't require, a regression analysis or something, more complex, but that can really show the impact of your program and what your program is doing. And so I guess my one lesson learned is to not be afraid of data, and just to kind of get in and I get dirty with data, if I can say that.
Yeah.
We, especially as a state, we are becoming more and more data-driven, and so we have to be able to support the long-term sustainability of our programs through that piece. And also, as far as kind of getting buy-in from the team, and also in your courthouse and your community, I really see it as it is part of the coordinator's role, but I see it as a team responsibility as well. And so as the coordinator, making sure that you're providing information to each of the team members so that they can then go back to their colleagues and kind of their circle of influence and be educating them as well on the program, its efficacy, and kind of why we do what we do. And so those are the first things that come to my mind.
Excellent. Tessa, do you have anything that you'd like to add as critical lessons learned along the way?
Yeah, I would say the first one I would think of is similar to the polling question that in this role, you're kind of everyone's manager but no one's boss. That's hard. That's a really difficult role to play, and I think overall I've just learned that collaborations are really hard. It's a really hard work. It definitely pays off, but I think you have to validate that a lot, that it's really hard work. It can be political. It is a lot more political than I thought it was going to be when I came into this role, and I think, which just kind of ties into my next, I guess, critical lesson is, smile, be polite, and break down barriers anyway. You just kind of keep moving forward, even though it might, feel a little more uncomfortable than you think. The second piece that I've learned and that I've really been working on is just think bigger. Like, think systems focused and really think about how your drug court can be making a change in the bigger dependency and neglect system. You know, we have people come and watch fit court fairly often, and they come up to me afterwards or to the judge and they say that they wish that all families could be treated the same way here, or treated the same way in the regular dependency and neglect system that they are in fit court. I think there's just something intangible about family drug courts that can't always be shown in the data either, and we can apply that to the bigger system. I think coordinators are in a really unique role where we can take what we're doing and apply that to really make change for our families. Part of that means that in your role you have to balance those day-to-day needs with client needs, or I'm sorry, the day-to-day client needs with those bigger picture needs, which can be tricky too. But those are some things that I've gathered from my experience here.
You know, very excellent points. I can't thank you guys enough. I'm going to move this along just for time's sake and go to, we had a couple of questions that were really good that I want to get to. And so anybody else that has questions, type them in if you want. One question was, how do you negotiate conflict and differing agendas between the public defender who wants clients to succeed and child welfare who, and I'm just saying what the question says, who referred those who they think will fail. So basically what I'm hearing this question is how do you, as a coordinator, negotiate the conflict coming from different sides, and in this case it'd be public defender versus child welfare. If in fact that split exists, how would you go about that?
I don't mind starting with this, and then I would also love to hear Tessa's kind of on the ground experience as well. I think you're going to naturally find that because all the roles are very different in a court. But we also know what makes our family drug courts so effective is that team approach. And so, number one, I think it's really important to have a good understanding of the responsibilities and what each role is on the team and their responsibilities. And so when I travel around and I see lots of different drug court teams, one of the biggest areas of I think conflict come from a misunderstanding of each person's role and what they do on the team, and so I think being able to discuss that as a team, even set up a team building or set aside time that is outside of a normal kind of court and staffing time to really focus on that. And then I also think it comes down to a shared mission and vision. And so if you as a team, people generally do not like to have to go through and wordsmith a mission statement, but that process really helps people come together and figure out why are we doing this, and it also sets expectations and clear ideas about what are our goals and how are we going to reach them. And through that process, you can then really create some clarity with each of the team members and say, okay, we can all sit here and understand this is our main goal. Even though each of our roles are different, we have different responsibilities, we know at the end of the day we are here to, for these reasons specifically. So even going through that process, I think, can really help bring more cohesion to a team.
Absolutely. Tessa, do you have anything to add?
I would definitely echo what Brenna D was just saying. The mission and vision is so important, and I used to be one of those people that rolled their eyes and was like, okay, time to create the mission statement. But now I realize, if your team truly believes in your mission and in your goals, they're going to be excited about it and moving forward. I think that's a tricky one. I think, first of all, you need to kind of take a step back, too, and realize, is this kind of negative energy you're feeling coming from a particular person, or is it coming from the entire group? And I also think it could be a good time to make sure to be sharing your success stories and encouraging people.
Good point.
And trying to, keep people excited about what can happen here.
I think you guys, those are great points. And I want to add one thing, and then we'll do this next question before we move on to the next to end the webinar. We have some resources to share, but having been in many family drug courts, there is sometimes a common myth that all child welfare workers want the parents to fail, and that is absolutely, I have to say, not true. And so it's sometimes, I agree with Tessa, sometimes it is a personality, or maybe sometimes you need to check yourself and say, okay, do I have, baggage that I'm carrying around about child welfare because one time I had a bad experience? I think you have to take each person for what they come to the table with, be very open, and if in fact you do feel that there is a partner at the table who is not invested in helping this family succeed, I agree with something that Brenna D said. You've got to take that head on, and you've got to be you've got to bring that conflict up and have discussions around it. You'll probably find out that that's not true, but I think I definitely hate to leave this webinar feeling like we just bashed child welfare. I mean, they're a critical partner. Everyone at the table is a critical partner, and you have to really look closely to figure out, what is it that, what are the dynamics, and how do we get everybody to understand what is it we're working for and what's each person's part. So I think, thank you for that question. We have one more, and I think it's important, so we'll get to it really quickly. How do you bridge the gap with child welfare service to give referrals for clients? And so what I'm hearing there is that sometimes there's more services needed for our families than what maybe child welfare is able or is able to offer. So I think that's the way I read the question. I hope that's correct. I want to see if Brenna D or Tessa, you have any feedback on that question.
Sure. I would just say, I think that's part one. We want to make sure that human services are, that they have good information, that they're fully bought into the program as a team member, and then that's part of the coordinator's role as well, is really, and Tessa described this really well, is knowing your community resources, what's available, and then it's kind of connecting those dots between what's available and what the client's needs are.
Excellent. I'm gonna move us along, and so I want to say thank you for those folks who gave us those questions. Just a reminder, sorry I just sped past that, we have the post-webinar Q&A discussion, so please join our conference call immediately after the webinar. I'm going to turn it over really quick to my coworker Jane Pfeiffer to talk about the upcoming webinar. So Jane?
Hi, thank you, Teresa. Thanks so much. So this is a reminder for some, and we'll be sending out some information to all of you about how to register for our next webinar. It's going to be held May 14th, and on May 14th we're going to focus our discussion on the webinar around case management, and specifically we're going to continue our leadership discussion, and we're going to be focusing on some issues around line-level case management, functions and roles. We're going to talk about case management. Your case managers may come from child welfare, from treatment, from court or community-based organizations, and we know that there's just a wide range of methods and strategies on how case management is being carried out in family drug courts across the country. And so I'll be moderating, facilitating our discussion, and I'll be joined by two family drug courts, from folks from a couple of family drug courts who will be able to talk about different ways that case management is carried out. We're going to talk about unique challenges of case management in the family drug court setting, and we hope that you'll be able to join us May 14th.
All right, Jane, thank you so much. So the next thing we would want to cover, in case you don't already know, is that we have so here's our blog spot at www.familydrugcourts.blogspot.com, where you can get lots of information around peer learning courts. We have some FDC podcasts, which are excellent, some leadership resources that some of you asked for, some videos, and webinar registration information. And then just wanted to, I think I went past our Save the Dates, but we have a whole series of Save the Dates for our Leading Change webinar series, as you can see here, so please calendar those, and we always send out reminders, but if you're not getting those, hopefully after today you will. If for some reason you're not getting them, you have our email address because of this webinar, so please let us know and we'll make sure that you get that information or any other information that you'd like to have from us around technical assistance. We want to say thank you. We really, really value your input, so please take a moment to complete the evaluation, and you can multitask doing the evaluation while you call into the post-webinar call. So please do the evaluation and give us as specific a feedback as you can to help us plan more webinars. So here again, to join the post-webinar conference call discussion is the number and the conference ID. And we certainly appreciate all of your time this afternoon. We hope that we addressed some of the questions that you had, and we hope to talk to you soon. Thanks so much. Have a great afternoon.